So Leanna, the nurses, in order to get these contracts, need to interview with the pharma companies, is that correct?
Yes.
So what kind of questions would they even ask?
Before every interview, the pharma company will send a copy of the protocol, which is the study. The CNRA needs to review the protocol, and any questions that they have, they need to set it aside, because that is part of the interview process. You want to be inquisitive about their study. It's their baby. They created it. They made it. They want you excited about it. So you do need that as part of it. But I've been asked questions because of the industry, having certain candidates come through that don't know what they're doing. They'll ask us our nursing questions, which is like, what is ANC? What is a CBC? You know, things like that, which we already know, which is easy. And it depends on the indication. Like with interviews with oncology, which was my bread and butter, there would be things like, tell me about RECIST criteria. It's a criteria they use for oncology. And so we'd have to explain that to them. Or ANC, you know, the laboratory and neutrophils. So anything that's related to the study and the indication from that protocol is pretty much what you need to know for that interview.
Okay, so they give you the protocol and you literally have to study and make sure that you understand, one, the vocabulary, and two, like the physiological processes of what's going on and what you would be responsible for.
Yes.
I can see how that would be so much better for nurses, yes. Okay, and so they ask you questions about the protocol, but are they asking you other questions as well?
They do. They ask you questions like, how would you review a chart? You know, what would you look for? A lot of those questions are based on the protocol, though. The protocol has standards and guidelines on what they want you to actually pull from a chart. It's pretty much black and white when you look at a protocol, so it's easy to answer those interview questions. Plus, the nurse knows exactly how to review a chart. And how to keep a patient safe and how they talk to. So a lot of the interview questions are, how would you talk to the clinical site? What would you tell an MD, a medical doctor, that there's an issue with his charting or his data? You know, so they will discuss, you know, interview questions such as, you know, have you ever had a difficult doctor to deal with? I think nurses are really comfortable with those kinds of questions.
Yeah, that's not a problem. So then in your program, is this something that you help nurses through with like mock interviews and how to prepare for something like that?
I will be helping each nurse with mock interviews and with their initial contracts. If there's a protocol in place, I will be able to help them with the protocol itself and be able to identify all the potential questions from the interview.
Excellent, thanks.